third thing I think that will help you, and this is not medicine necessarily based at all in terms of knowledge, but observe your preceptor or other providers involved in your rotation. Observe how they interact with other providers, observe how they interact with patients. For myself, I remember specifically seeing this one doctor, every time he'd walk into a room, sit down, every time. And I was like, that's kind of crazy. Like, I mean, everyone's busy, but the fact that he takes the time to sit down in every single room. And what I noticed was that he had much more ability to connect with his patients and get information that maybe another provider didn't get out of that patient because they're sitting eye level with them and have this connection. I was like, wow, that is crazy. And we've learned through studies and things that really is a real thing, but I didn't really seen it take place to that extent. So something I took from that was literally every time I walk in a room, if there's a chair available, I sit on the chair. I mean, half the time I'll sit on the end of the bed, just watch out for the dirty Chuck's pad, but I sit down on the bed. Sit down and try to have a connection, just even if it's only for the 3 or 4 minutes you have. That was something that I saw just from observing that provider's behavior. Yeah,
you know, and the interesting thing about that is that you don't have time for that. Yeah. So that is a purposeful decision to go in and say, I'm going to sit down. And along with that, you have to figure out how to guide the conversation a certain way so you're not in there for 45 minutes. But everyone's busy, and you will notice on rotations that everyone is just kind of grinding through. But stuff like that really stands out, especially because the patients are used to people grinding through. So the guy that comes in or girl that comes in, sits down and says, hey, so, how'd you sleep last night? How's your pain doing? Like, you could say the exact same things from the doorway, but they're not going to mean nearly as much as if you sat down. But that's beside the point. Your point is observe, look for those behaviors that stand out to you that you think, oh, I like that.
Or don't like that.
Right. Like, or the converse is also true, which is, boy, I do not like how that one talks to patients or staff or whatnot.
Yeah, they walk in and, I think you mentioned this before, they walk in and just turn off the TV right away. Like, sure, I need you to turn it off, but like, I can do that in a totally different way than personally be the one that walks up and presses the button. Okay, mental note, don't be that guy, because it all of a sudden the patient's like, hey, I was watching that, just like you would be at home.
Right. Right. Yeah. I mean, this preceptor was he's a nice guy, but he would come in, wouldn't introduce himself, wouldn't say anything, would just go up and turn the TV off. Yeah. And it's going to be turned off at some point, I'm sure, but you just need to say, hey, my name's Chris. I'm here with cardiac surgery. How you feeling today? Do you mind if we turn this off real quick? I mean, so much more respectful. Yeah. And then also the same guy was in surgery. We know kind of the steps so much that we can hold our hands out and sometimes, most of the time, the tech will just put what we need into it. But sometimes we'll have to ask for something. And if we're concentrating, we don't necessarily use the words. So we might use our fingers like this, because this is, I need a forcep, or scissor, we might, hey, cut, or something like that. We were up on the floor, so not even in the OR, with a non-OR nurse taking a bandage down. And he looked at her and he was just like, and she was like, blank. Yeah. Like, what I did, is he have a twitch? Like, what's going on? And he did it again. And I knew what he needed because I'm watching him need to cut the bandage off. And he does it again, like super exaggerated. And she's like, do you need a scissor? And he's like, yeah. And I was like, okay, oh man, this interaction is not going to go well. Yeah. So, watching how people...
Mental note, right? Okay, I observed the behavior in the OR, and that's how that works.
Right.
Observe that doesn't work somewhere else.
Translate, yeah, for sure.
I think one thing I picked up on a lot was how they interact with, nursing staff. A lot of, nice thing about being a PA is a lot of people have worked as techs and have been in the hospital. So they have some of that already, but to watch as a provider, someone that's, in charge or giving orders, observe how to do that effectively and with kindness and compassion in a way that you don't come off as a prick, because sometimes they're going to disagree with you, and that's okay. But observing how to do that, because that is not something that you learn in school. It's not something that you learn in a textbook. It's done on the job, interacting with people. So if you can watch how other people do it and learn what to do or not to do, you will be better prepared. You're still going to do it wrong sometimes.
Right. You're going to be tired, or you're going to be run out, or someone's going to ask a really stupid question. And there's a difference between lashing out or just responding. And unfortunately, you're right. It's not taught in school. And if you just are so inwardly focused and you're not paying attention to how you're treating people, you're making your reputation. And so if you are rude or condescending, and sometimes that comes from a place of not knowing the right answer. You feel challenged. And so someone says, hey, the Zofran didn't work for nausea. Can I try something different? And in your mind, you're like, crap, I can't remember what else do you give for nausea. You might say, no, Zofran's fine.
Yeah.
Snap back at them. Number one, it's not. They just told you that. And number two, just pause for a second. And you can even, I've said this before, you can twist the tables a little bit and be like, oh yeah, absolutely. What's worked well for you in the past?
Because usually they know.
They will know. They'll tell you.